There are a ton of different exercises that we can use for low back pain. In this video, we're going to go over the 5 most common exercise progressions that can be useful for low back pain. But before we get started on some of the exercises, let's go over a couple of important points here. The first is looking at how exercise actually helps with low back pain. We used to think that low back pain was caused by instability and core weakness, and that's why core exercises were helpful because they would strengthen the muscles around the spine, leading to a more stable spine. But when we actually look at the research, the mechanism of how exercise actually helps with low back pain isn't that clear. Strengthening can definitely be a component of it, but there seems to be some other mechanisms that are at play for how exercise actually helps with low back pain. And this transitions into the second point, that technique and form might not matter quite as much as we previously thought. And that's because when we thought that these exercises had to strengthen the muscles around the spine to be effective, then it made sense that we were trying to get the most muscle activation with these exercises. But that's not necessarily the goal with these exercises. Of course, getting stronger is a good thing, but it doesn't necessarily mean that it's going to help with the pain. Instead, technique allows us to modify which tissues are being loaded with these exercises, and it also allows us to change the position a little bit if we're experiencing pain in any position while still getting some muscle activation of those core muscles. So with all that being said, let's get into the exercises. The first exercise progression is the plank, and it's probably the most commonly used exercise for low back pain. And the reason why is because it's a low load exercise that allows us to start loading the abdominal muscles in a position that most people are able to tolerate. And so we'll start with planks on knees and then gradually progress the difficulty of the exercise. So for planks on knees, generally we start kind of in a quadruped position here. And as we start to kind of walk out here, we'll start to feel our abdominal muscles kind of kick in to engage here. And so the further out we go, the more challenging it's going to be. And so we can start to straighten out our hips here, and this will be a little bit more challenging. And then eventually we can actually go down into elbow here and then just hold this position. There's no right amount of time to actually hold these positions for. Originally, it was about 10 seconds, and that had to do with some of the oxygen availability in the muscles, but we can actually hold for longer periods of time. It really depends on what somebody's response is to these positions. The next progression is actually just to go up on our toes, which is kind of the standard plank. And so from plank on knees, we can just extend our legs up and hold this position here. And so generally the typical recommendation is to have shoulders, hips, and ankles all in a straight line. But it's okay if we actually plank up a little bit so our hips are a little bit higher up in the air. We will get a little bit more hip involvement in this position, but if that allows us to hold that position and then gradually work further down to increase the difficulty of the plank, then that's totally okay. The final plank progression is a buttress plank. And so we'll start in a high top position, which just means our hands are going to be on the ground. And the goal for this exercise is just to lift a hand up off the ground and alternate. And so everything else should stay relatively still except for the hand that we're moving. To make this exercise a little bit more challenging, we can bring our feet closer together and then repeat that same movement. The next exercise progression is a side plank. And so again, we're going to start with a side plank on knees and then gradually increase the difficulty of the exercise. So in this position here, we're going to have our knees stacked, elbow underneath shoulder. If we have some shoulder discomfort with this exercise, we can either make a fist, and that'll help kind of recruit some of the muscles around the shoulder, or we can take our top hand, put it on top of the shoulder, and pull down to give it a little bit of support. If we don't have any shoulder pain, we can really put this hand wherever we feel is most comfortable. And so from this position here, we're going to push our hips forward and lift up off the ground. And so this is going to work the muscles that are closest to the ground. Again, there's no perfect amount of time that we want to hold this position. Generally, we want to hold it for more than 10 seconds, but if we want to hold it for as long as we feel comfortable, that's okay as well. It really just depends on whatever your tolerance is. We can then increase the lever of the side plank by progressing to a side plank on our feet. So we can either have our feet stacked or one foot in front of the other. It doesn't really matter when it comes to muscle activation. It really just depends on which one you feel more comfortable with. If you feel like balance is a little bit of a concern, then having the one foot in front of the other provides a little bit more support. But again, it really just depends on what you feel more comfortable with. And so again, we're just going to lift up, try to push our hips forward. One thing when we're looking at form for this, if we want to get a little bit more of the muscles on the side here, we want to be perpendicular with the ground here. If we're rotated a little bit back, we're going to get a little bit more glute to push us up. And so we want to just try to keep that nice perpendicular position here. The final progression is a rotating plank. So we're going to go from a side plank to a front plank and then to the other side for the side plank. And so for this one, you're gonna have to have your feet one foot in front of the other. The top foot is gonna be in front of the back foot. And so we can start in that side plank position here. And so for this exercise, we wanna try to lock our shoulders onto our hips so they move at the same time. And so what it's gonna look like is we're gonna take our hand and we're gonna rotate to that front plank, and then we're gonna lift up the other arm here, and then rotate away. So now we're on that other side plank position. Generally, we hold each position just for a couple of seconds, and then we'll come back to the front plank, and then lift, and then rotate back to the side plank. The next exercise progression is the glute bridge, and as the name implies, it'll be focusing on the glutes. And this exercise progression is particularly helpful for those with low back pain with extension. And the reason why is because when the glutes contract, it actually puts the spine in a little bit of flexion. So this exercise progression allows us to start loading the spine while being in a flexed position. So to perform, we're gonna start by laying on our back. And the closer our heels are towards our body, the more glute activation we'll have. The further our heels are away from us, the more hamstring activation. So we wanna have our heels relatively close to us. And then from this position here, we'll contract our glutes, lift our hips up off the ground, and then slowly back down. When we do these, we wanna try to get full hip extension, so we'll get the most glute activation, and then slowly back down here. The next exercise progression is to do a marching bridge. So the beginning stays the same. We're gonna contract our glutes, lift our hips off the ground, and in this position, we want to just lift one of our legs off of the ground and then switch to the other side. And the thing to focus on is that when we lift this leg here, this glute has to control for rotation and also keep our hip extended. And so every time that we switch, we want to try to keep the hips up off the ground and nice and still. And the final progression is a single leg bridge, where we're going to do multiple reps on one leg. We can hold our leg up towards our chest, or we can have our hands down by our side. It doesn't matter. The big thing is we're just trying to get full hip extension here, and then slowly back down to the ground. The next two exercise progressions are a little bit more integrative. They're still going to work on the muscles around the spine, but for these progressions, we're going to be using our arms and our legs while we do them. They're really similar to each other, but the only difference is that one's going to have a little bit more emphasis on the abdominals, the other one's going to have a little bit more emphasis on the back extensors, but really they achieve a very similar goal here. And so first we'll start off with a bird dog exercise, which we're going to start in a quadruped position here. And so we want our hands underneath our shoulders and our knees underneath our hips. And the first movement is just going to be lifting our arm up overhead and then slowly back down. Ideally, when we're doing this, the only thing that's moving is our shoulder joint here. And so once we're able to do this here, then we'll switch to our legs. And so we're going to push our heel back behind us like we're trying to reach towards the wall, and then come back and switch sides. The main thing we want to try to avoid here is rotation of the hip, if we can. It's okay if your low back extends a little bit while you do this, because whenever we have hip extension, we're going to have some low back extension as well, so that's perfectly normal to happen. Once we're able to do just arms and then just legs, then we could do opposites. So we'll do opposite arm, opposite leg, and then back, and switch. And then we'll do one more on each side here. And if we want a little bit of a challenge, we can actually move our arms and our legs in a couple of different positions so we can make some shapes. I'm making squares here. You can make circles, whatever you feel like, just to kind of increase the difficulty of that exercise a little bit. And then the final exercise is a dead bug. And so we're going to be laying on our back here. Our knees are going to be roughly over our hips, and then our hands are just going to be over our shoulders. So again, it's basically just the flip of the bird dog. And so again, the progression is very similar. So from here, what we're going to do is we're just going to drop our arm back towards the ground and then switch sides. Generally, the movement we're trying to avoid here is extension, which is why this gets the abdominals a little bit more. And so again, we'll just drop our arm down towards the ground and back up, and then the other side. Then we can progress to legs. So The first progression here is just to keep our knees bent, and then we're going to just tap heel down towards the ground. This is a lot more challenging for those abdominal muscles because our legs are a little bit heavier. The tendency is that we want to try to rock and extend through that low back. It's okay if that does happen, but if we want to challenge ourselves, we can try to just engage those abs a little bit more to resist that movement. And then once we're able to do that, then we can extend the knee, increasing the lever, making the exercise a little bit more challenging. And then finally, just like we did for the bird dog, we're going to do opposites. So we'll drop opposite arm and opposite leg, and then back up. And if straighten the knee here is a little bit too challenging, again, we could just switch to keeping that knee bent just to decrease the lever on the lower body, and then gradually increase to extending the knee. And obviously these aren't the only exercises that can be helpful for those with low back pain. There are actually a lot of effective options available to us for the treatment of low back pain. So there's not one must-do exercise or one best exercise program for us to do. Everybody responds a little bit differently to exercise, so it's really finding which exercises help to decrease the low back pain, whether that's core strengthening exercises like we did in this video, general strength training, aerobic exercise, or yoga and Pilates. All of those can be helpful for the treatment of low back pain. So it's not essential to do one specific exercise type. We actually can just pick whichever one helps to decrease the pain and do that one. So hopefully this video was helpful in demonstrating some exercises that can be used for low back pain. If it was, go ahead and give this video a big thumbs up. If you want to support the channel by subscribing, hit this icon over here. I'll see you guys in the next video.